Okay, first things first. It's just after 4 p.m., everyone. Welcome to our workshop, a closer look at health administration. I'd first like to give a couple introductions to your hosts today and also our presenter. We'll be speaking with an NJ HOSA alumni with firsthand experience in the industry of health administration. Before we introduce him, I'll introduce myself. My name is Dorian. I'm serving as your state parliamentarian this year, and I hope you're all excited as I am for this workshop. So with that, I'll pass it off to Matthew.
Hi, everyone. My name is Matthew Hunczak. I'm your state historian, and I'm so excited to be here with you all. Now I'd like to pass it on to Kirolos.
Thanks, Matt. Hey, everyone. My name's Kirolos. I'm currently serving as your Southern Regional Vice President for this year, and I'm also really excited to be here. And I hope we all get to take away something beneficial as we leave.
Great. Thank you, Kirolos. Okay, now that we've introduced ourselves, we'd like to introduce our main guest for this afternoon. He's currently the Director of Operations for Sight Saving Academy India, if I'm not mistaken, right? Yeah, we'll get on with that. Please give a warm welcome to our alumni, Snehal Parikh.
Thank you, everyone. I appreciate you giving me the opportunity to speak to you all, and excited to talk a little bit about public health today. So thanks for having me on.
Thank you. We're just as excited to learn all about it. And thank you so much for joining us. We really appreciate you taking the time out of your day to be here with us. We have a couple of questions for you, and so does our audience. Members, if at any point you have any questions to ask our guest here, feel free to put them in the chat or private message one of us with them, and we'll be sure to have it answered. And with that, we would like to start off with our first question. So tell us a little bit about your career and how you got there.
Sure. So I was very fortunate to kind of be born into a healthcare-oriented, public health-oriented family. My father was the director for the state of New Jersey, Commission for the Blind and Visually Impaired. He just retired a couple of years ago, and so that's kind of where I found my roots as an avid avid public health professional. Probably in 2004, I went to my first iCamp, where I started off just translating for patients. So I speak a couple of different languages, and in New Jersey we have a very diverse population. A lot of people don't speak English, and so that's kind of where I found my roots, just helping with the health literacy component, translation component. You have a lot of physicians and healthcare providers who don't speak those languages, and I, at a very, very young age, was helping with some basic translations. And so that's kind of how I got my start and peek into public health. And man, after that, it's a very, very long story as to how I kind of expanded my realm of knowledge, my depth, my breadth in public health. But just to kind of try and summarize, from that point on, I took on any volunteer opportunities that I possibly could. I never cared about money. I just wanted to make a dent in society and provide value to the community that has given to me much more than I can ever repay. And so not only was I involved with the Commission for the Blind, but I got involved in other blindness prevention programs, nonprofits throughout the state, like Lions Club. You had India Health Camp. You had Sight Saving Academy, which I currently work for. All these organizations kind of became a part of me, mainly, in my high school days. And not only that, but because I went to the Academy for Allied Health Sciences in Scotch Plains, I was also able to get EMT certified. And I worked for my local rescue squad since my freshman year. So that's how long I have been in EMS as well as public health. And not only that, but in high school, I got involved in some research experiences, public health focused. One at New Jersey Medical School, and the other at the Environmental and Occupational Health Sciences Institute. So very public health focused research. And then from that point on, I ended up going to an undergrad institution that had a top 10 public health graduate program, and was very lucky to just be immersed with countless opportunities in public health. Like you name it, they have it. They're doing research, they're doing policy work, program implementation. And so there I worked in everything from EMS to the opioid epidemic, to the Affordable Care Act, to the Violence Against Women Act, and really just tried to expand my understanding of the intersection of public health and medicine. And now I am here trying to help provide some relief, much needed relief, to vulnerable communities during the COVID-19 pandemic.
Thank you, Snehal. Oh my goodness, your experience is astounding. That's the fact that you started out from when you were really young, and it's all kind of just built up until now. That's really awesome to see, with all of your volunteer experience and all your research experience, everything. Just wow. But now I want to ask you, I want to know, like, how does HOSA tie into that? Do you feel that HOSA has helped you in your career development and all? And if so, how?
Absolutely. HOSA is absolutely invaluable in my career trajectory. I don't think my high school experience would, or my undergrad. I was also involved in HOSA when I was at the University of North Carolina. I don't think I would have gotten as much out of my high school and undergrad experience if it wasn't for HOSA. And it's so multifaceted. Not only, again, being part of the Academy for Allied Health Sciences was HOSA integral part of our curriculum, but also it gave us experiences in leadership, which in the public health setting is an absolutely invaluable competency. It gave us some insight and avenues to exercise our leadership skills. And my family has a long-standing legacy of, holding leadership positions in HOSA. So my eldest sister was the president of HOSA when she was in the first graduating class of my high school. My eldest cousin was also the president and the state president of HOSA when he was in his high school. I served as the president for 2 years. And in doing that, we were able to, do a lot of cool programming and, work with your peers to have a really amazing impact, not just on our school community, but amongst all of our peers, to kind of take with them. Now we're all over the place in all sorts of different allied health careers. And HOSA was absolutely instrumental. At a more basic level, the competitions were they were highly educational, so tremendous amount of insight and knowledge gained from preparing for them. I did 2 competitions. I participated in biomedical debate, which we got the gold medal for my sophomore year. And then my senior year, I did the EMT competition, which we also got the gold medal for. And both of those things, being well-versed in debate is, it's a really important skill to have, especially in this climate where, public health is such a hot topic and there are multiple perspectives to any single issue. And also the EMT competition was wonderful because it teaches you really how to systemize your patient care and your treatment plans. And then when I went on to the University of North Carolina and had opportunities to train other folks, I really looked back to the preparation and just insight that I gained from preparing for the EMT competition, So in many ways, I can't really, it's not tangible, how much it has had an impact, but I do want to give a quick shout out to my host advisor when I was at the academy, Miss Larson, who poured her blood, sweat, and tears into, making sure that, we were as involved as possible. And also Miss Fuji, who was the state advisor during the time, who, made sure all of the schools were, really had all the resources that they needed to reach their full potential. And without those folks, HOSA wouldn't be what it is today in New Jersey. And so, salute to them for, giving me this opportunity today and, kind of paving the path for you all to be doing the great work that you're doing as well. So.
Well, we really love to see that, HOSA has such an enduring legacy in terms of professional and leadership development. So that was nice to hear. Let's sort of get more into what you're doing undergrad and grad. Given that you were on that pre-med track while at UNC, what experiences really turned you towards a career in public health or made you want to straddle that intersection between medicine and public health?
Yeah, so I think pretty early on, I realized that there was a gap. We're the only country in the entire world that separates our public health curriculum from our medical curriculum. And, I had a lot of experience in clinical care, not just as an EMT, but kind of just being immersed around physicians. I also had a good understanding of the healthcare system. I worked as a medical biller for a little bit. And I just saw this immense gap in our clinical care, as well as, kind of the policy side of things, right? In public health, one of our biggest components for public health is policy development, policy evaluation. And you saw that, the folks making these policies and prescribing, programs for the vast majority of the population had no experience in healthcare. And so that's what drove me into public health, right? I had all this experience in healthcare. I was still very, very passionate about medicine and wanted to keep the option open to become a physician. But, as I continued to, spend time in both, I realized that I just had so much more potential in the public health domain because there was such a necessity. And so, year after year, I sought out opportunities that would help bolster my, knowledge base of public health, and found myself having, being able to have that real impact and work hand in hand with physicians, with nurse practitioners, with physician assistants to help bolster their impacts, right? And so I had this unique background that allowed me to position myself as a liaison almost, right? And yeah, so that's what's kind of guided me into my current role. And yeah, looking back, I'm very thankful. I think I would be in medical school right now if it wasn't for the enlightening experiences that I had through my family and then from my undergrad institution.
Oh, thank you for sharing that. It's really amazing to see how you saw a need in that field and then you decided to dedicate yourself towards that. And it's also really interesting to see a different side of healthcare that's not as often seen as physicians, as you just said. But now focusing more on your career, what do you do on a day-to-day basis? What are some specific skills or competencies that you frequently use?
Sure. So this is a long question because I work pretty much work from the time that I wake up to when I go to sleep. And there's a reason for that. I don't recommend it. Self-care is very, very important. But for me, the way I get my gratification and happiness is through the work that I do. And that's what allows me to kind of stay on top of things. So I wear a lot of different hats. I'm not only the director of operations for SSAI, I also work for the CDC in conjunction with the New Jersey Department of Health on COVID-19 response. And I also am director of service for a national fraternal organization. In addition to that, I still work with my alma mater, UNC. I still work with students from the Academy for Allied Health Sciences. And all of the work that I do is very complementary. In reference to specific skill sets, they teach you a lot in the public health curriculums on specific skill sets that you should aim to master. So I think the biggest one for me is problem solving. In the US, there is a constant need because we have such a diverse demographic, we have such a diverse population and constantly changing needs for that population. Problem solving becomes very important, right? To determine the nature of a problem, identify all of the potential solutions, bring in stakeholders to get, their feedback, advice along the way, implement, an effective solution, and then be able to monitor and evaluate it, right? That's problem solving right there in a nutshell, right? There's so many different components to it, and it is difficult to follow through. It's easy to determine, what a problem is. It's easy to identify a solution. It may even be easy to implement a solution, but to do all of this in concert and then evaluate it and follow up and monitor that progress becomes very, very difficult. And that in and of itself relies on a lot of other skill sets. So data analytics, one of the best courses, or two of the best courses that I took at the University of North Carolina. Number one was Justice and Public Policy, which really focused on ethical decision-making in public policy and policy development. Another one was actually quantitative analysis in public policy, and that taught us how to do data analytics on programs, also just, being able to track evidence-based approaches to healthcare problems. And so this taught us to use informatics, right? We used a statistical software called R to essentially synthesize, analyze, and leverage data to act on specific health priorities and their impact on the population. And based on this data, you have to problem solve and do that continuous improvement, right? So I think this is really the crux of it. I mean, there's so many other things, general change management that ties into this, which is like, again, you have adapting needs, different environments, and being able to scale your program to respond in that moment to the specific challenge and the crisis. This is one of what's seen as the pitfall of public health is, we're not as adaptable as we should be. It took us a while to kind of, in the larger scale, like compared to 50 years ago, we're amazing. But with the level of technology and data that we have at our fingertips, we want to be so good. So change management, resource management, right? That ties into like fiscal planning, financial planning, right? How you're using money and specific funding, as well as general non-monetary resources that you have, developing a budget, defending budgets, right? And that ties into engagement with policy, right? Being involved in legislative efforts, establishing relationships with policymakers, potential stakeholders that are engaged with public health concerns and the needs of your local community, or whether if you're working for the state, then the state government or federal government, right? There's a wide variety of other things as well. Just general communication, health literacy is a really big problem right now. And so being able to break things down and make them easy to understand. So if you're getting this arsenal of data, how do you communicate that? How do you communicate risk, right? Especially during this pandemic, so that you're encouraging people to be prepared, but you're not, causing them to get panic. Establishing relationships with community members, so they can further your impact, right? Because one person can't do everything, but if you build relationships and you build these networks of folks who are really passionate about these causes, then you can make sure that whatever time and energy you're putting into response and mitigation has the biggest potential. And then kind of overarching on all of this is leadership, right? You can't do anything on your own. And if you don't have leadership skills and you're not kind of focusing on collaboration amongst public health, healthcare, and other organizations, educational organizations, et cetera, your time and energy will not be as effective as it could be. And that, also comes in, that also incorporates training, mentoring, the folks you work with, thinking about, how your leadership plays into other systems, right? Whether it's the government, public health agencies, nonprofit public health agencies, private, and so on and so forth. You have to be able to manage organizations, guide that continuous improvement based on data like we talked about, and really build your system, right? So I know that's a lot, but any role is going to rely on many different skill sets, and so those are just some of the ones that we implement in public health.
Thank you, Snehal. You really covered a lot there. There's, as you said, there's really so many skills that you need to master, regardless of what profession you go into, whether it be public health or if you want to become a physician, etc. Now, I want to ask you more specifically, is there maybe perhaps a certain project at work you've been on that felt rewarding? What is the most rewarding project that you've worked on thus far?
I think if you ask me in 5 years, it's going to be the COVID-19 pandemic. But right now, it's easy to feel a little bit lost. Cases are rising again in New Jersey. We've poured our blood, sweat, and tears into this cause. We started out back, 1 year ago to date, and we started off just, feeding our hospital workers. That was the biggest thing. Hospital workers were getting overwhelmed, and they didn't even have time to sit down to take a break. They couldn't sit in their lunchrooms, and because of fear of exposure. And so that's where we started off. Providing relief was, making ready to go, ready to serve meals for hospital workers in the New York, New Jersey areas, because we were hit first in the States. And then that initiative kind of evolved, right? Then there was the PPE shortage, and so we started sourcing masks, gloves, gowns, sanitizers, all sorts of PPE to provide hospitals. And we started to brand this as the meals, masks, and medical service mission. Probably in late May or June, we started to, or actually even before that, the next thing we did was start connecting recipients who are in need of plasma donation to potential donors. So this was before the American Red Cross had a systemized donor recipient system. We were literally making phone calls all over the country to try and source plasma, try and source blood donations for folks who were a match to critically ill patients in the hospital. So that was the next step. Thereafter, a lot of people were facing hunger. So we started trying to collect donations and delivering groceries to refugee populations, low-income families. In June, the statistic right here in Middlesex County was 1 in 8 families didn't know where their next meal was coming from. That was from MC Foods. That's the Middlesex County Emergency Food Distribution Network. And so we started delivering all these groceries to food pantries and families who were facing hunger. Right now, even we have a nationwide food pantry collection that we're doing called the People's Pantry. We went on to, really try and help with patient navigation. So folks who are getting coronavirus, how do they navigate the healthcare system? What medical resources are available to them? What non-medical resources are available to them? We help folks with everything from mortgage and rent relief to funeral planning in the worst cases. And so overall, it was a constantly evolving and again, one of those classic change management scenarios. Even to this date, we're helping. I get over 100 calls on my cell phone every day for people looking for the vaccine, and using Twitter. Honestly, they have vaccine notification profiles on Twitter, which I've been using to help elderly and folks with comorbidities, get the vaccine. And so all of this is, really important work, and we do what we can, but unfortunately we're not seeing the numbers go down. And so it does become, you feel a little bit defeated. But I digress. To answer your question, as of right now, I think probably the most rewarding project that I've worked on in the past was in Whitesburg, Kentucky, my freshman year of college. I stayed in Whitesburg, Kentucky, very rural town, probably about 10,000 folks, I believe, is the town population there. I worked on a project called Operation Unite, and Unite stood for Unlawful Narcotics and Investigation, Treatment, and Education. And so we worked hand in hand with the judicial system, rehab facilities, and local law enforcement to help folks who are struggling. This is in the epicenter of the opioid epidemic, where you're losing thousands of lives every single year. So we worked with all 3 of these branches to be able to, not necessarily penalize, these folks who were using illegal narcotics, but to identify them and connect them with rehab programs so that, they could taper themselves off their addiction and hopefully lead a better life. And so I think that was probably one of the most difficult, but also one of the most rewarding roles and projects that I worked on.
Well, it's great to know that you have such breadth with all the projects that you've been involved with, and seeing that shows the diversity of roles that someone in public health will play. So just to sort of dovetail off of the point I just made there, what advice would you give to our members when exploring different healthcare fields, and I guess any advice specifically to people interested in your career field? So,
Yeah, sure. So, pretty cliche, but follow your passion, right? Don't let others dictate your goals, right? There are so many avenues. Like, forget about medicine, right? That's just one track. But even in medicine, you have so many different fields that you could potentially, undertake, right? So if medicine has this many fields, think about healthcare, right? Overall, you have so many different avenues. Figure out what your passion is in life, where you find gratification, because you're not doing this for a job, right? That's not the point. This is not, you don't want to have to call your profession work, right? That should be your life's biggest source of gratification, right? Just the same as family, just the same as like any hobbies you have. Like, I'm not going to undertake a family. I'm not going to marry somebody who doesn't, give me gratification, right? Who's not going to make me super happy. Same thing should be in your work. Don't do things that you're not 100% passionate about. You don't see yourself putting your 110% into. So that's like the first thing that I would advise folks who are interested in public health or healthcare in general. Follow your passion. And I know that sounds cliche, but a lot of us, we have different pressures on us, including me when I was, navigating my career in high school and undergrad. Lots of pressures. And I stood up for myself. I knew where my greatest impact was going to be. And if I talk to those people now, they'll tell me, oh, you know what? I'm glad that you did what you were passionate about, because that's why you're having the impact on lives, right, that you're having right now. And in that same vein, take care of yourself, right? Not everything is about helping others. Right? I say this from experience. If you can't pour from an empty cup, right? That's what one of my mentors told me. You can't pour from an empty cup. Sometimes, folks in our field, we want to do so much. We want to help others. We are so giving, don't become a martyr, right? Because if you sacrifice yourself and your mental health and your ability to take care of yourself, you're not going to be able to help others the way you want to. So in that sense, be a little selfish, okay? Third thing, have goals, okay? I don't agree with the standard college sentiment that, oh, don't worry about it, you can go undecided, okay? Have a goal, right? That doesn't mean you have to have everything figured out. And God knows that I didn't have anything figured out by the time that I was in, my first year of undergrad. But I had goals, right? I had like the 6-month plan of what I wanted to do. And then that constantly evolved, as you guys have seen, right? So that's really important, right? Generally, folks who are pretty single track minded and singularly focused are the ones who are going to be the most successful. You will never find that spreading yourself thin actually makes you more productive. It's not going to happen. That's just our disposition as human beings, right? So if you have that singular focus, it doesn't have to be for the next 10 years, but at least for the short term, even if it's just a couple of months, you have one goal that you want to achieve and you work towards it. The probability that you achieve that goal compared to having 4 or 5 different goals is going to be exponentially higher. So that's number 4. 5, ask for help. Ask for help. right? We're all very competent. Anybody who wants to go into healthcare, is very, very smart. I don't see doctors as smarter than EMTs. I have worked with EMTs that have better clinical judgment than a lot of providers that I've seen, just to put it bluntly, right? We're all smart people, right? But we have to know when to ask for help, right? Just because you're competent doesn't mean that you don't need help, right? We all need help. We all need, two heads are smarter than one, two brains are smarter than one, right? So build relationships, make mentors, right? Whether that's with your peers and having your peers support you, whether that's like having good relationships with your faculty, with your teachers, so that they can give you, they can kind of take you under their wing, share their life experiences with you. And that's like even more amplified when you get to college, right? Because that's really when you're going to be alone for the first time. And mentorship and a sense of community is really imperative to establishing success. And the last thing I'll say on this topic is you are not your work. Build a life outside of your profession. Be well-rounded, right? Take up a sport, go on a hike, right? Be physically fit, right? Focus on your family, like you don't want to look back and say, oh man, I didn't have enough time with my parents because I was so focused on my studies. And I think that's something that's really come to light in the current pandemic, right? It's like how valuable our families are and how valuable this time has been to kind of spend it together. Parents are working from home, you might not have had that quality time, and you get to, get some really, really nice memories for the long term. So that's the last thing I'll say is just, be well-rounded.
Thank you for that amazing advice. I can say I'll definitely be using that as I continue in my healthcare journey. And I think all of our members should, because that will really set you up for the most success. So now that we've asked some questions, we'd like to turn it over to our audience and have them ask a couple questions.
That's right, Matt. So let me explain how we're going to do this. We want to keep this as efficient as possible. There's two ways you can ask your questions if you have any. If you want to ask it yourself, you feel free to raise your hand using the raise your hand feature on Zoom, and we'll call on you in the order that you show up on the screen to say your question. If not, you can just leave your question in the chat and one of us here will read it out loud for you.
Don't be scared, y'all.
All right. Do you have any questions? Oh, someone did.
Got one.
Someone did. So you can unmute and ask the question. Go ahead.
Where did you find those research opportunities in high school?
Yeah, good question. So the Liberty Science Center, actually, that's where I did it through. They have a program called the Partners in Science program. They pick, I believe, about 20 or 25 high school students. Either you have to be a rising junior or a rising senior. And they actually give you like a nice little stipend, get you connected with a specific research institution that matches your interests. And it's, it really is a really enriching experience because you're getting exposure to a research endeavor that most folks would not have exposure to until they go to college, at the very least.
That was a great question. Anyone else? You can also use the chat. One of our members was asking about approximate salary. So could you speak to that?
Yeah, to be honest, the public health workforce does not make a lot. So I would say if you're, an analyst, a public health analyst, or just like an entry level worker, you can expect somewhere around 75,000. However, and it also depends on the sector that you're working in, right? Government, nonprofit, private, all have different salary ranges. It's really going to be about who you work for. I do know folks in the public health domain that are making good money, well above six figures. But those are the folks who have, a significant amount of leadership experience. They are not at the entry level. They're leading organizations, and they generally work in the private sector. But to be honest, I don't think most folks work in the public health domain for money. They see the public health domain as the compensation is the impact that you have, right? And I mean, my father always used to tell me, do good work, don't worry about the money. Do good work and the money will be there. You'll never have to, worry about how am I going to pay this next pay, which is a very real and, valid concern to have, absolutely. But in this sort of line of work, my take on it is do good work, do quality work. People will pay you for it. People will make sure that you're compensated well if you're bringing value and passion. And that has definitely been my experience.
Right. Certainly. Those are some wise words there. Next question I got from the audience was, what would you say is the key difference between public healthcare professionals and medical professionals, and how do their educational journeys differ?
Yeah, so public health is definitely way less intensive in terms of the academic side of things, educational side of things. But it is a lot more extensive in terms of field work, right? Before you get to an actual, management or leadership position in public health, you're going to have significant amount of field experience under your belt. And so field experience just means on the ground experience. So you're working in, a public health setting, possibly far away from home, and learning those public health competencies through more tangible work. Whereas medicine in a medical career, you are going to do a lot more. You're going to have a lot more of an academic focus. And so the stuff that you learn is going to be very, text-based, practicum-based, test-based, right? And so that's the real difference in, academically. Again, that's not to say that one is harder than the other. I think, both professions are very hard to be successful in. But, in terms of kind of distinguishing what's right for you, you have to, again, you have to follow your passion. If you think that, if you're really passionate about biology, anatomy, physiology, cellular development, and on top of that, the patient care aspect, medical school is right for you. If you love program implementation, program evaluation, policy development, government affairs, those sorts of things, public health is probably good for you. And that's not to say you have to choose one either. If you like both things, you can go to medical school and be a public health practitioner, right? That's what a lot of folks do, right? They go to medical school and then they become a health director for a county, right? They're an MD, but they work on the government side of things, the public administration side of things. And so you can, you can pursue, your interests across domains. But again, it's just about being passionate about the work that you're doing.
No, the two fields have their similarities, their differences, but both are really great careers and are really big roles in the healthcare world. One of our other members asked, what was your specific educational path and how many years of education was required for you to be where you are now?
Yeah, so for me, I am kind of an odd example. I only have my bachelor's right now. So pretty much everybody around me has higher degrees than I do. But you can't really substitute experience. There's in public health, there's not much of a replacement for experience. Now, that's not to say that at some point in time, I am going to go back to school and, potentially do a very focused academic curriculum, maybe a PhD in health policy, or a DRPH if I'm, if I don't want to be too specific. But as of right now, for the work that I do, my experience and the competencies that I've garnered from my undergrad education have sufficed. But in the next few years, I will be going back to school, because there's also, just as there's no replacement for experience, there's no better investment than education. That's my personal take on it. And so I love school, but for me, I need experience to guide my education, right? I want to know what I'm getting out of my education, right? And so this, even just, all this work that I've done in the past couple of years, COVID related, has really allowed me to have a specific focus and desire for my future academic path.
I totally see the experience and how the schooling goes hand in hand. It's definitely a balance and both are amazing. We have a question from our amazing state advisor. What about dual tracks, being a clinician and like an academician, even though you kind of just touched on that balance, but what do you think?
Absolutely, yeah. So that's a great question. I mean, there's degree programs, right, that you could do 2 degrees in conjunction with really any path in healthcare. It doesn't have to just be like an MD, MPH, or MD, JD. You could do, I know nurse practitioners who have their master's in public policy or master's in healthcare administration. I know pharmacists who have their public health degrees. Don't be afraid to take on a dual path, because it's going to make you more unique, and it's going to allow you to have a skill set that's more marketable, in the job market. And so again, it goes back to your passion. For this specific question, I think you said it's, being a clinician and an academician, and that would potentially be, doing an MD, PhD, right? Where you're a physician, you have potentially like a hospital affiliation, but you're also able to do research, right? Rutgers has many of those types of individuals who not only see patients, but also are, doing research on the side. And again, it just helps them bolster their impact by straddling multiple domains. So it's possible. You should definitely have a good amount of exposure before you decide on any specific path. I wouldn't just go for an MD, PhD because it seems enticing, but you want to have done research and love research, and you want to have worked in a clinical setting and love the patient care aspect. And then if you see yourself kind of being able to bridge that, right, gap, then it's a great idea to do one of those dual degree programs.
All right, are there any other questions that we can take? Going once.
Safe space, y'all. Any questions are welcome.
Seeing none, I guess we'll proceed to the end of our Q&A, and that's the end of our workshop here. Matt, take it away.
Yeah, we would just like to take a moment to thank everyone who came to our workshop today. Your enthusiasm and your questions that keeps us motivated to keep making more of these workshops for you. We hope everyone got to take something away from this session, some of the amazing advice we got. And we would also like to give a big thank you to our interviewee for taking time out of his very busy schedule to be with us. Your time and knowledge are both greatly appreciated.
Just
Alrighty,
one.
thanks.
No, continue.
I was just saying thanks everyone for having me. Appreciate it.
No, really, Snehal. It was a pleasure to have you. Thank you so much for sharing your wisdom and experience with us. It was really nice to hear everything.
My pleasure.
No, really, it's mine. Thank you. Just one final reminder for everyone before we go. I just want to remind everyone that the award ceremony for our state conference is this Friday at 7 p.m. We're going to be announcing all the winners for the competitive events, as well as the new state officer team for the 2022 year. So be on the lookout for that.
Right, of course. So thank you all so much for your attention and your questions, and we hope you have a great rest of the week. See you virtually, of course, at our awards session this Friday at 7 p.m. Just like Kirolos. Bye, everyone.
Thank you.
Everyone, thank you so much.
Great job, everyone.